Thank you so much for that introduction here. My name is Sagar Shah. I am a family medicine, integrative medicine physician. I'm just so honored to be here today. What these guys are doing with Flux Life is honestly is unbelievable, and it's really I think the future of how medicine should be practiced and how medical care should be delivered, especially empowering individuals to really make lifestyle change. And we're going to talk a lot about that today over the next few minutes. I just want to say that I try very hard to not deliver too much information all at once. In this format, it can be pretty boring pretty quickly if someone just talks the entire time. So please, if you're feeling like you have a question or if you want to interrupt, go ahead and do that. This is a very informal conversation, and so please do interrupt if you need to. You can just unmute yourself and talk. Unfortunately, I can't monitor the chat box at the same time, but if someone sends a chat, then maybe Noak or Lily can let me know or interrupt at that point too. Hopefully, we'll have some fun over the next hour. I just listened to a Zoom presentation a couple days ago at work, and I, again, realized that it can be kind of, you need to be engaging the entire time. So, I want this to be, useful for you guys. So with that, I'm just going to get things started here, and let's see if I can share a screen. Did that show up okay? Can you guys see it? Okay, great.
Yes.
So, the title of this talk is Integrative Approaches to Prediabetes, How to Stop Mopping the Floor and Turn Off the Faucet. And we'll, be able to see what exactly that means pretty soon here. So I want to just briefly tell you about myself. So I am originally from Chicago. This is a map I tried to draw myself, so hopefully it looks somewhat like the US. But I originally am from Chicago, and I moved from there to Baltimore. I studied at Northwestern for college, and I studied history of terrorism, religion, and creative writing. You'll notice that there was no science in there. My science class was on dinosaurs, actually, because I just wanted to get a science credit at that time. And I wasn't really thinking at all about medicine. My father and my brother are both doctors, and I just, it wasn't really something that seemed appealing to me at that time. But I was really interested in working with refugee populations and internally displaced populations. And so I had an opportunity to go to India after the tsunami in 2004, and that really changed my life. I worked with a bunch of doctors who travel from village to village and make amazing lifestyle changes in their patients and find unique solutions to, long-term health issues. And that really made me realize that medicine is a gateway to really be able to understand people better and to be able to help make positive changes in their lives. So I went back to school, and I traveled from Chicago all the way to Baltimore, Maryland, and I was at Hopkins for a little bit of time there, and then worked in Children's National Medical Center in DC, then Philadelphia for medical school, went over to Madison, Wisconsin to do my residency and fellowship, and my residency is in family medicine, so I'm a family doctor, and I also study integrative medicine. I did a fellowship in integrative medicine. And I'll explain what that means in the next slide. I really believe that this is the way that medicine should be practiced in general. And again, it's very much in keeping with the approach that Flux Life is taking. So while I was in Madison, I also did my MPH at Emory in Atlanta and working with the CDC, and then went over to Honolulu. And that's where I met these guys and really had the best year of my life. I was there exactly a year to the day working at Kaiser. And from there, my heart stayed in Hawaii, but I moved to Portland, Oregon. And part of what I've been doing for a long time is working on bringing integrative medicine to the VA, the Veterans Department of Veteran Affairs, and in the largest health organization in the country. So the VA really has made some amazing changes. And for those of you guys who know veterans, they are now able to get chiropractic and acupuncture and massage therapy, medical hypnosis, a whole variety of things that we've been trying to bring in, along with really intensive nutrition therapy and exercise therapy and a lot of things that really make a difference in their lives. So that's been a national project with hundreds of millions of dollars of funding. And that's part of why went over to Portland because I was constantly traveling back and forth to mainland, teaching around the country. So um, that's kind of where I'm at now, and who knows where we'll be next, but we still have a family and so many friends in Hawaii, and we're back and forth there. So I'm just, again, really happy to be here today. So what is integrative medicine? Just to, if you guys don't mind raising your hand here, raise your hand if you are familiar with integrative medicine. Okay, yeah, so some people, but most people are not. Integrative medicine is, first and foremost, is evidence-based, okay? So we're still using all of the evidence around us, and we're making, appropriate decisions based on that. But what we're doing is we're combining all different approaches to medicine, and that could be, characterized as Eastern versus Western, and everything in between. And so a good example would be that when I'm treating a patient with depression, I am helping them, teaching them how to meditate, teaching them or connecting them with some mindfulness resources. We're helping maximize their exercise program. We're connecting them, with a therapist. We're still, sometimes prescribing medication. Sometimes we're using adaptogen herbs or, supplements that can be helpful. And we're really trying to expand their connection to the community and to the people around them. So what we're doing is we're really treating every aspect of who they are and trying to promote self-care and self-healing. And we found that this approach really makes a difference, because if you look at the left side of this next screen here, option A, this is what modern medicine really is. We tend to say, oh, you have a headache, here's a medication for that headache. Or you're having type 2 diabetes, so here's a medication for that. High blood pressure, here's a medication for that. And it works to some degree, but for every 5 medications that a patient is on, they take a 6th medication because of the side effects of the first 5. Can you believe that? So ultimately what we're doing here is we're kind of complicating their lives and not always achieving the goal of care. And the other thing we're doing is we're missing the root cause of, so if you guys can, if anyone can, shout out, you can unmute, what would be one example of a medical issue that is really at the heart of all of these conditions, or that could be causing a lot of these conditions?
Obesity.
Any ideas? Perfect. Yeah, that's a great example of one thing that can be causing many of these conditions. So how do we get at the, to help that condition? And another thing that we do, you look at the right side here, option B, what we do is we put the patient at the center. So the first thing I ask every single patient when I see them is, why do you want your health? What matters to you at this stage in your life? What do you care about? And, I try to understand, okay, well, for some people it's being there for their grandchildren. There are some people who, being outdoors and, being in nature, hiking is really important to them. And then we cater all healthcare decisions towards achieving those goals. So, your healthcare should serve your goals, not the other way around. And, that's kind of the best way to think about a whole health integrative medicine approach. And you'll see here on the right side, where we're again looking at so many different aspects of their care, especially exercise, sleep, nutrition, mind-body work, and their surroundings even. So that's integrative medicine in a nutshell. And we'll kind of shift gears now and talk a little bit about prediabetes. So why am I talking about this topic? Well, this is something I'm really passionate about. I do lecture on diabetes and prediabetes. I also just recently had the opportunity to write a chapter in a textbook on prediabetes. And in doing that, doing the research for that, I was able to review over 100 articles, and I found some pretty amazing information, that I didn't know going into the situation, even though I've been teaching about it. And so I want to share some of that with you. We're going to talk a little bit about why it matters. We're going to just present very quickly a case that I recently had for a patient. I'll come back to that and talk about how we treated him. And we'll talk about what's going on in our body when we have prediabetes and how do we treat this. And then, at the end, if you have any questions, but also even in between, if you have any questions, please just let me know. So why does this matter? First of all, a huge portion of Americans have it, okay? Even in Hawaii, a recent Department of Health study that was done in Hawaii, I think it was from 2016, said that it's estimated that 54% of Hawaii's population has prediabetes or diabetes, one of the two. Now, this is crazy because Hawaii is considered the healthiest state in the country. And even then, this percentage of the population has prediabetes or diabetes. And what's crazy is that only 25% of the time are they aware of that diagnosis. So you can have prediabetes and not even know it. And the thing is, as clinicians, we're not doing a good job of actually explaining that to our patients. That's crazy to me, that we're not addressing this really serious issue. And I'm going to explain to you why. Another important thing is that 70% of those patients with prediabetes will go on to develop diabetes in their lifetime. So this is a serious thing that we need to address. It's first and foremost, not just the precursor to disease. It's not just the thing that will develop into diabetes, but it's actually a condition in itself. And the reason this is important, the amount of medical issues associated with prediabetes is enormous. And so a good example of that would be chronic kidney disease or heart disease, dementia. Just having prediabetes and never developing diabetes, your risk of dementia goes up significantly. To me, this is crazy. And we really need to be addressing this. Even different types of cancers, the risk goes up. And for a lot of my veteran patients, they start to really especially be invested when I tell them that erectile dysfunction is associated with prediabetes. What's really interesting is actually, we'll come back to this case in a second. The idea of the cutoff for diabetes for hemoglobin A1C, A1C is a measure of 3 months of your blood sugars, okay? The cutoff of diabetes was set at 6.5%. Does anyone know where that cutoff came from? And you can just shout out if you have any guesses. Any ideas? Well, I'll just tell you. So that cutoff number came from they thought at that point that the risk of retinopathy or problems to your eyes actually starts at 6.5%. That's why they called it diabetes. It's kind of an arbitrary number. Well, actually, that we now know that number starts even at 5.7%, which is where prediabetes starts. So again, all of these things that we were worried about with diabetes actually happen in prediabetes. So we need to be catching this much earlier. In terms of A1Cs, 5.7 to 6.4% is prediabetes. And what's really crazy is that the number that we're constantly using, the lab we're using, which is that A1C, actually underestimates how many people have diabetes or prediabetes. There was a recent study of 9,000 adults who didn't have a diagnosis of diabetes from 2005 to 2014. And what they found is that the A1C underestimated it a huge amount of the time compared to a gold standard test, which is called a 3-hour glucose tolerance test. That test it takes a lot of effort to perform, so most labs don't do it. But my point here is that so many people probably have this and we don't even know about it. And if someone does have prediabetes, they may even already have diabetes actually. It's just that our lab tests are not good enough to detect it properly. So I'm going to quickly go back here. I want to tell you about a veteran I saw recently. This is a guy, we'll call him Nelson. That's not his real name, but we'll call him Nelson. Nelson, I saw him in January of 2020. At that time, he had severe depression. He had completely checked out. He had lost his job. He was essentially sleeping for most of the day. He was actually not eating much, but he had gained a ton of weight from eating a lot more prior to that. He was up to 368 pounds, and he felt his best around 220 pounds, by the way. He was not active, and he was not taking medications. His thyroid, his TSH was in the 80s, and that's really high. His thyroid was very uncontrolled. He was hypothyroid. And then his blood pressure was, all the way up to the 200s over 100s. So incredibly uncontrolled at that time, and he just didn't really feel like living. He said multiple times he didn't have a plan, to hurt himself, but he didn't feel like living at that time. So just keep him in mind, keep Nelson in mind as we talk through, the next few minutes, and then we'll come back to him and talk about how we, use this approach that we're going to talk about to treat him. So I'm going to take a couple breaks in this presentation because otherwise it might be too boring for me to just keep talking. Just a random fact break here. This is a little bit crazy. We're going to be talking a lot about nutrition. In an average lifetime, a human will eat about 70,000 pounds of food. What's crazy is if you eat animals, you're going to eat about 7,000 animals in your lifetime. That's crazy to me. What's also crazy is we tend to have about 152, I've seen 156 pounds in other places of sugar every year. So can someone tell me, back in 1820, how many pounds do you think we consumed per year of sugar? If you can just, unmute yourself and talk. Any guesses?
3 pounds.
That's really close. Yeah, we had 2 pounds of sugar every year back in 1820, and we now have 152 pounds. We eat our weight in sugar every year now, which can be really disastrous to our health. We're constantly making food choices. So I just wanted to throw out some random facts there to, again, not make this too information heavy. So let's get back to prediabetes and diabetes. So in terms of prediabetes and diabetes, we're not going to go into this for too long, but we think that there's kind of stages of how we develop this. And you can kind of think of it as there's some sort of predisposing factor that's triggering this. So we might think of the foods that we're eating or our genetic propensity, and we'll talk a little more about that. Smoking, inflammation in our body, or stress or lack of exercise. Whatever's happening, we then develop insulin resistance. And we're going to talk a little more about that stage in a second here. So once you develop insulin resistance, that means our body is not properly processing the insulin that we make. And I'll tell you a little more about what that means. And then we start to develop a variety of conditions that we call metabolic syndrome. Type 2 diabetes is one of those conditions, and prediabetes as well. So when we think about insulin resistance, it essentially is where prediabetes starts. So we're not going to go into this in a lot of depth here because I don't want to lose you guys in the process, but I want to just tell you a couple of things here. First of all, many of us think that you either have diabetes or don't have diabetes. We think of it as almost like a light switch you turn on and off. Well, that's just not true. Diabetes exists on a spectrum, okay? So there's different stages that then lead to the development of diabetes. Again, that arbitrary number that we've chosen, versus pre-diabetes or being, non-diabetic. We kind of think of a couple different areas of our body here. One of them is the pancreas, and in the pancreas we have these cells called the beta islet cells, and they are responsible for making a hormone, and that hormone is insulin. What insulin does is it helps in the cells around the body. It helps bring in blood sugar, glucose, into those cells, okay? When it does that, it helps to make sure that we don't have too much sugar circulating in our cells. And this is incredibly important to our body. And the reason is that when our red blood cells have sugars on them, it actually causes damage to the blood cells, and our blood cells provide nourishment to our whole body. So that's the pancreas. That's happening in one area. And then in another area, the insulin is going to the cells, and it's working on the membranes, the edges of the cell, and it's creating this whole signaling pathway, which leads to the cells taking in the insulin and the insulin working properly. So there can be a dysfunction either in the pancreas or in how the cells are taking it in the insulin itself. Okay, well, there's different stages that happen along the way. At first, your body is starting to get more sugars in its blood, and your body's saying, okay, I'm just going to respond by making more insulin. And those beta cells in the pancreas are doing their job, but then they start to get bigger and bigger because they're working too hard, and they get tired out. And as they get tired out, we go to what we call stable decompensation. They're still doing their job, but they're just not doing it as efficiently, to the point where they're not doing it efficiently at all. And then your body eventually has a much harder time making insulin. Well, what's really crazy is that injury to the cells, that inflammation and that damage actually can be reversed. So there are studies that show even when you develop diabetes, you can actually reverse it on a cellular level, and those cells in the pancreas can regenerate. Meaning we can go backwards. Once a diabetic, always diabetic is not true. And we really need to be aware of that. We can reverse this. And the specific things that reverse it are diet and exercise, especially. So we now know this on a cellular level. And I think a lot of clinicians still act like once you have diabetes, you always have diabetes. That is just not true. And we'll talk about it with this case coming up. So a lot of people say, well, you know, diabetes is in my family. It runs in the family. I'm probably going to get it, right? Well, only 8% of diabetes cases are related to genetics. So for all of us, including myself, who have family members who are diabetic, we don't have to think of it as a death sentence. You know, what we do in our lifetime, how we care for ourselves will actually make a difference in determining whether or not we develop diabetes. The other thing I want to mention here is that we kind of think of, okay, well, we have these genes and then they influence our body and how we, you know, develop diseases. That's not the way it works. We now know with something called epigenetics that we have genes, and the genes turn on and off proteins that affect our body, and the lifestyle around our environment around us and the choices we make, whether we exercise or not, the foods we eat actually turn genes on and off. So our lifestyle actually turns our genes on and off, and then our genes affect our lifestyle. It's a back and forth process. What I'm telling you here is that we can actually change our genes if we do the right things, you know, if we live a healthy lifestyle. One other thing I want to mention, because, you know, many of us are from Asian background, we actually, you know, our risk of diabetes goes up after a BMI of just 23. So even at a lower weight, our risk goes up. So let's see here. So I'm going to keep going here. So if lifestyle is the cause, you know, 92% of the time, it's also the treatment. So what are we talking about? We need to focus on nutrition, physical activity, sleep, stress management, and, you know, maybe in many cases, some pharmaceutical medication or supplements. And I want you to think about these as the medication and supplements as temporary, ideally, if you make the right changes, you know, with the other four things. So I'd like you guys to just look at this picture and tell me what you're seeing here. Maybe someone can shout out what they notice here.
Not taking care of the cause.
Yeah,
An
off the
overflowing
faucet.
sink.
Yeah, overflowing sink, not taking care of the cause. I have a friend who is Thai, and I showed her this picture, and she's like, "Oh, it's just a bunch of Americans wasting water," which I thought was kind of funny. But this is basically, you know, this is how we're managing heart disease and diabetes. We're constantly, you know, trying to treat the problems that happen because of these conditions, but we're not actually getting to the root cause. So, you know, just keep this in mind constantly with any medical condition that you might present with. So in terms of nutrition, the good news is that there are so many different diets that can be beneficial. And, you know, what we're going to talk about is not to tell you to follow one specific diet. This is kind of a pet peeve of mine. We tend in medicine in the US to say, hey, you need to follow a Mediterranean diet because that's the best evidence. Well, first of all, there's no one Mediterranean diet. There's like 20 countries that border the Mediterranean Sea. So really, there are varieties of diets that are Mediterranean type, but also we need to think about what foods are in that and actually put them into the cultures that we come from. So, you know, I'm not going to tell you, hey, follow a Mediterranean diet, follow a DASH diet, follow a, you know, purely vegetarian diet. What I'm going to tell you is eat certain food groups that actually have been shown to lower your risk of developing prediabetes or diabetes or reversing, and it can help you reverse that process. So it's not just about avoiding foods, it's increasing the foods that actually can help. So a lot of the information that we have comes from something called the EPIC trial. The EPIC trial is a huge trial that's on cancer nutrition throughout Europe and has hundreds of thousands of participants, been going on for a long time. And what they found is that the type of protein we consume matters. And animal protein actually increases our risk of developing prediabetes and diabetes. So that's not just red meat, that's all animal protein. Fish are not in that category, by the way. So, but animal protein increases our risk of developing diabetes. So maybe if you decide that you still want to have that in your diet, you minimize how much you have, and try to focus on other foods as well. Or you cut it out altogether, whatever fits your lifestyle. And it is important to note that if you do eat animals, make sure you're having grass-fed organic, because the nutrient quality is significantly better. I didn't include some slides on that here, but there's good evidence for that too. So animal protein increases our risk, but actually vegetable protein decreases our risk. So, having increased legumes, nuts, seeds can actually make a difference. Just as a little rant, as a little aside, in the US, we tend to have on average 120 grams of protein a day. That's a standard American diet. We really only need 50 to 70 grams for average weight, and the rest gets converted to carbs and fat. So we keep thinking, oh, we're eating our protein, nearing our protein, we're going to bulk up, this is what we need to do. Well, it's actually not true. We're actually converting to the types of exact foods that we're trying to avoid. I'm just going to plug in the computer here so it doesn't die. There we go. Okay. Crisis averted there. So, again, it's really important that we're, thinking about different types of foods and not just taking a blanket approach of, hey, cut out carbs or increase protein. It's the type of each of these foods that matters more than anything else. By the way, in terms of carbs, there's a study that showed that, a pretty large study that showed that both high carb and low carb diets actually cause us to live, increase our mortality, cause us to die faster. So cutting, again, we need to not try to take these radical approaches, and we try to think about what specific foods matter. The reason why the low carb diets actually were not helpful is because we replaced those carbohydrates with unhealthier alternatives usually. So what foods actually help? Let's talk about that for a second here. Well, one thing is we want to get 7 to 9 handfuls of vegetables and fruits daily. I say vegetables before fruits because there are more abundant nutrients in a lot of vegetables are consumed than fruits, but fruits are still great. So again, we need to get away from this idea that fruits are bad for prediabetes, diabetes. That's just not true. There's a lot of evidence showing that fruits are beneficial. Having varieties of grains in your diet, quinoa, amaranth, farro, buckwheat, oats, barley, wild rice, teff, rye, all of these grains are so good for us. So more grains, the better off we are. Having varieties of legumes like beans and not processed soy. Having nuts, 1 to 2 handfuls a day. If you eat fish, that's great. Fish are really good for you. Having 2 servings of fish per week would be great. That gets you enough omega-3 for the whole week that you don't need to supplement at all. That's over 2,000 milligrams of omega-3. So, these are the types of foods that we need to make the staple of our diet and try to make that, the basis of our food pyramid. A couple of rules that you can try to follow to really help reverse prediabetes and diabetes is to aim for more fiber in your diet. A goal would be to get up to 30 to 36 grams of fiber with meals per day. You can go even higher than that, but that would be a goal. That's a lot of fiber, but if you have 7 to 9 handfuls of vegetables and fruits, you're actually already around 24 grams. So, that's one thing to keep in mind. A really good rule to follow is to look at the sugar and the fiber in the foods you consume. So if you are looking at the nutrition facts, make sure that the sugar is not more than 5 times the amount of fiber in the food that you're consuming. That's going to prevent your blood sugars from rising too quickly. I can always explain that in more detail if you have any questions about that. All artificial sweeteners, except for stevia, so far we haven't shown that that's been harmful, but all artificial sweeteners otherwise increase our risk of diabetes and prediabetes. So avoid artificial sweeteners. That is not the way to go. And cut out sugar-sweetened beverages. This is a huge area where so many people are increasing their risk. What's crazy is just 1 soda per month increases our risk of diabetes. 1 soda a month. So we really need to be cutting that out. and eat whole foods whenever you can and avoid processed foods. It's a very simple thing. If it has a ton of ingredients in it, it's most likely processed, and you're losing the healthy nutrients in there that actually can help us. And the last thing is to consider intermittent fasting. Has anyone here done intermittent fasting at any point? Can you guys, do you mind telling me how you did it?
I did it in relationship to a exercise program, and it was very hard, very. I didn't have much success.
Yeah, tell me, was it every day, or how did it work?
I think it was one day a week.
Uh-huh. Okay. Yeah, so there's a few different ways that it's typically done. The three most common are either to eat within a window. So often it's an 8-hour window. Some can be 10 hours or 12 hours too. And eating earlier is better. Following the circadian rhythm is better. So, maybe eating, for example, from, you could do 6 a.m. until, 2 p.m. or 4 p.m. or 6 p.m., depending on what length you're doing. That would be an example of one way to do intermittent fasting. Another way to do it would be to do a 5-2 type of method, where you're eating normally 5 days a week, and then 2 days a week you're eating in a smaller window. Or you actually fast, 4 certain days of the week, which is what you had mentioned, Sally. So, that might be the hardest one to do, but there are other ways to do intermittent fasting that is more sustainable. But intermittent fasting has been shown in recent studies to actually help lower our risk of diabetes and help lower our blood sugars when we have diabetes.
Okay.
So we talked about eating whole foods. I just want to show you this. This is all the stuff that's in a donut. So, when someone at work brings a donut to work, and back in the day when we went to work, someone would bring a donut to the break room. And, we don't think about it. Look at all the crap that's in our food here. I mean, this is insane. We don't even know what half of these things are. When you eat broccoli, your only ingredient is broccoli, so just think about that. I'm going to take a little commercial break here to promote a book that I absolutely love. Has anyone read this book or seen it? This is the best nutrition book I've ever read, and I highly recommend it. It's called Eating on the Wild Side. And actually, the way I learned about this book is that I was teaching a bunch of clinicians in, I think it was in Florida. And one of them had mentioned, like, you haven't read this book? How can you have not read this book when you're lecturing on this? And he was right. This book goes through over 1,000 studies, and it summarizes information in a really basic way that's easy to read. I mean, you could read it in a bathtub. It's just very easy to read, but it tells you how to grow, how to buy, how to preserve, how to cook fruits and vegetables to maximize phytonutrients. So I'm going to give you an example of how this worked. My wife we recently had a baby, and Audrey is now 11 weeks old, and in her first couple of weeks, my wife was breastfeeding, and she got a mastitis, an infection of her breast, and she had a temperature up to 102 at that time, and some redness on the breast. We had to wait a little bit of time before we could get in with the doctor and get the antibiotics. So before that happened, I had her crush garlic that was from a farmer's market, and 3 cloves of that. And we waited 10 minutes to maximize the release of an enzyme called allicin. And allicin has been used to treat infections for hundreds of years. And she took 3 of those cloves twice daily. And before she even got the antibiotics, her temperature went down to normal. And there are actually studies that show that the right type of garlic can actually in that amount can be equivalent to a dose of penicillin. But this book talks about that, for example. It also talks at one point about how if you boil your potatoes a day before you consume them, and then put them in the fridge and then cook them however afterwards, the amount your blood sugar rises is only by half of what it would have otherwise. There are all these cool tips and tricks in this book, so I highly recommend Eating on the Wild Side. And it's on Amazon too. So going back to, how do we manage prediabetes from a lifestyle standpoint? Obviously, we really need to be focusing on how to increase our activity. What's really crazy is just one episode of exercise can actually improve how well we control our blood sugars for 3 days afterwards. Can you believe this? Just one episode of exercise can affect us for 3 days afterwards. We are not doing enough to push this in our patients and to help build this into their lives. And when we do, we give very generic recommendations. Hey, go exercise for 30 minutes a day, 5 days a week. What does that mean? How is that going to become an actual routine? Well, there's different types of exercise that we really need to be thinking about building into our lives. And, we need some combination of these exercises. When I say aerobic, anaerobic, and equilibrium, I'll give you an example of each of those. An example of an aerobic exercise could be walking with ankle weights at a moderate pace, or riding your bike. Anaerobic exercise could be, weightlifting or body weight exercises. And equilibrium training could be Tai Chi or yoga, which kind of helps us with our balance too, and does a lot of other things for us. But we want to build in, these types of activities into our lives. And then on top of that, we call that intentional activity. We're purposefully building that time in. We also want unintentional activity. So unintentional activity is, how do we build this into our lives so that we're constantly moving, taking the stairs when we can? How are we, parking farther away from where we need to go and walking, or just, biking or walking to where we need to be? How are we getting more activity and, maybe, putting on a step counter and actually trying to aim for 10,000 steps a day, for example? So most societies where they're maintaining a relatively healthy weight in their population have a lot of unintentional activity built into their lives. And the final thing I want to mention here is there is evidence that high intensity interval training, which is very trendy right now, actually does help to lower blood sugars more so than other forms of exercise. So I'm sure you'll be able to get a lot of information about that from Lily, especially in Flex Life. And if you have any questions about high intensity interval training or otherwise, definitely, please feel free to ask. So, maybe we might say, hey, if you're, at risk for diabetes, or you have prediabetes, why don't you, or even otherwise, let's build an activity regimen. Let's do 20 minutes of body weight exercises. Maybe they're lunges, squats, push-ups, sit-ups, whatever combination we decide to do, 20 minutes of a yoga or Tai Chi routine, and 20 minutes of riding a stationary bike, or riding a bike outside, or walking with ankle weights. So that would be an example. And then how do we also incorporate at least 1 to 2 hikes in a week? In Hawaii, this is like the best resource that Hawaii has. How do we take the stairs more often, park farther away, and, again, get to places by biking or walking when you can instead of driving? So another thing I want you guys to do, actually, if you can, if you are, sitting right now, please take a moment to stand up. I'll do the same thing here. The reason is that just standing for 5 minutes every half hour can improve our blood sugar, similar to walking. So let's say you're in a job where you're sitting long periods of time. On average, Americans, we sit 13 hours a day, which is crazy. But standing for 5 minutes every 30 minutes will have a significant impact on lowering our blood sugar. I mean, this is such a simple thing that we can build into our lives. So again, I'm getting information heavy here and I'm overloading, but let's take a second here to do a little random trivia break. So I'm going to mention a few things here, and you're going to tell me, you're just going to shout out an answer. What do you think these have in common? A dinosaur skull, a 9-foot Egyptian burial tomb, an octopus, pygmy heads, 15 homes, including 2 European castles, and 1 limited edition Superman comic book issue. Does anyone have a guess?
Sell for $1 million.
Okay, sell for $1 million. What else we got?
Rare.
Rare. Anyone else? So
$15 million.
15, okay, we're getting a little closer. Who knows who this guy is?
Yes, but I can't think of his name.
Nicholas Cage.
Nicolas Cage.
Nicolas Cage. This is all the stuff that Nicolas Cage blew $150 million on. He
Oh
blew his
my.
whole fortune on this stuff. So pretty crazy. I just couldn't believe it. I learned about it in a virtual bar trivia the other day, and oh my God. He owned 2 castles, and yeah, I couldn't believe the cheapest thing he bought there was the octopus, actually.
Yeah.
So, all right, we'll get back to things. So we've talked about exercise, we've talked about nutrition. Well, let's talk about sleep here. Sleep debt, meaning when we're not sleeping enough, we're getting behind on sleep, can actually affect our blood sugar. It prevents us from properly processing our blood sugar with our insulin, and it has a huge dramatic effect on that. So after we eat too, our blood sugar goes up even more, 50% higher if we're not sleeping enough. And what we need to be doing is getting 7 to 9 hours of sleep per night. So, this is really, really important. Often when we have diabetes or prediabetes, we're just not thinking about the impact sleep has. And so many conditions are impacted by our sleep. So aim for 7 to 9 hours of sleep per night. And make sure you're getting good quality sleep. What that means is also skipping that nightcap, that drink at the end of the night. It actually helps you get into the early stages of sleep, but it blocks you from those late stages, especially stage 3, 4, and REM. So for many of us, that's something important to consider. And then, of course, if you have something like sleep apnea, a condition like sleep apnea, it's really hard to control your blood sugars. And at any point, I can tell you more about that. But that's another part of helping manage this condition. So what about our psychology? Well, this is pretty crazy. If you have prediabetes, you're at higher risk for developing depression. And patients who have both prediabetes and depression are more likely to go on to develop actual diabetes. So I'll say that again. If you have prediabetes and depression, you're much more likely to be in that category of people who eventually develop diabetes. And what's really interesting is psychologically, if you have prediabetes or diabetes, you're more likely to respond to negative stimuli, meaning a negative event happens in your life, it's more likely to have a bigger impact on you. So somehow this is changing our psychology too. And that means that we also have to think about the psychology of the person in order to properly manage this condition. So, we really have to think about how do we help manage their anxiety, their depression, or anything else going on in order to help. And, studies do show that that can lower your A1C by, close to 1%. So, just addressing this can matter. This book on the left here, Diabetes Burnout, is a really great book on cognitive behavioral therapy for diabetes, and it's directly, for patients. Also on Amazon. So we're almost done here. What about some supplements to think about? Well, the 3 supplements that have been shown to be most effective for prediabetes and diabetes and lowering your blood sugars are magnesium, chromium, and zinc. So, you might think about how to do this. Now, more is not always better, and this is a really important thing to think about whenever you do have supplements. Zinc, for example, if you have more than 30 milligrams a day, you actually prevent your body from absorbing iron and copper. And copper is one of those things in our body that actually helps us to make our neurotransmitters, our adrenaline, for example. So, you do not want to overload it. And unfortunately, when you buy zinc, it's usually in 50 milligram tablets. They don't sell it in the proper thing. So you can't trust the products, themselves. So, the supplements that really work the best are these 3, and they're generally pretty safe. In terms of pharmaceuticals, there is no pharmaceutical that has been shown to be, to have anywhere close to the benefit of lifestyle change for prediabetes. So no medication has been shown to be as close to, metformin, our best diabetes med. Lifestyle change was twice as beneficial, as metformin in the diabetes prevention study. And so, yes, in some cases, especially if our weight is very large, our BMI is over 30, then in that case, we'd be, suggesting possibly using one of these medications, but we need to be thinking about these other aspects of caring for ourselves that matter way more for prediabetes. And there's a lot of meds out there, by the way, and they're very expensive, but having reviewed all of that, there's nothing that comes close. Let's go back to Nelson.
Sagar, this quick question.
Yeah, please.
Could you take a 50 milligram zinc tab every other day?
Yeah, I would say it's much better to cut it in half and take it every day, but you could theoretically do that. The question is also how much you're absorbing when you take high doses of supplements. Your body may not absorb as much. Probably the safer thing to do is take 25 milligrams every day. Any other questions about the supplements? Okay, great. Thanks for mentioning that. That's a good point. So let's go back to Nelson. His A1C was 9.6, and he's well beyond prediabetes, right? But I wanted to give you an extreme case just to show you what this approach does. Again, he was depressed. His weight was 368 pounds. We work with him very closely, and my team is myself, a nurse who is also a former chef, and we have a second nurse, an LPN, and then we also have a medical assistant. And we worked with him very closely, and we came up with a plan that really incorporated better sleep quality, treating conditions like sleep apnea, treating his depression, treating his and anxiety and his PTSD as well. We helped to lower his blood pressure. We put him on meds initially, and we also helped to control his diabetes. And he wanted to do it by lifestyle change. So we did it without medication. So this is crazy. His A1C went from 9.6 to 5.0, and his weight went from 368 pounds to 286 pounds in that time. This is a pretty awesome change that we were able to see here. He was exercising for an hour a day, and the way he did his Bowflex, actually, he was turning anaerobic or weightlifting activity into aerobic activity. So we came up with a plan to do that, and by the time this was done, he was off of his high blood pressure meds. He didn't even have high blood pressure. A guy who had blood pressure in the 200s over 100s didn't even have high blood pressure anymore. And, he was on half the dose of his thyroid medication. He felt so much better. And what's so great is his whole family made change. He had 2 kids who actually had childhood obesity, and they were all making positive changes already too, and his wife as well. So, this is the type of approach that really can help make a difference. He was working to get a job as of July. He was, looking for a job. He was feeling a lot more energized, feeling so much better about himself. I think this is the power of integrative medicine and of lifestyle change. And, in particular, in this case, for a patient who had diabetes, who no longer has diabetes. So we would say in his chart, he does not have diabetes.
Hey, Sagar,
So
I think Jill has a quick question.
Oh, yeah, please. Oh, sorry, Jill, I think you're on mute still.
I'm good. Sorry, I hit that by mistake. Sorry.
Oh, it's okay. Okay, sure. So what I want you to take away from this is, taking this approach that we call integrative medicine to, so many different conditions, not just prediabetes, can make a huge difference. And the basis of that, the foundation, is lifestyle change. In terms of integrative medicine, there's so many other things to think about. So for example, one of the things that I do to treat people is called fascial distortion model. It's a manual manipulation technique that is used all over the world and has a huge benefit. Even patients who tear multiple rotator cuff muscles, we can treat them in one visit and get them to have full range of motion in their shoulder.
As a question.
Yeah.
So with Nelson's lifestyle change, the diet he went on, was it strictly vegetarian?
Yeah. So I'm sorry, I didn't even mention that. Thank you for bringing that up. So his diet was actually pescatarian. Okay.
Fish.
So
how does shellfish work into this?
Shellfish are not going to have much omega-3, and they're bottom feeders, and they tend to have a lot more contamination, and they're just not as good for you. Yeah.
Oh.
So, that wouldn't be one of the.
So limit the shrimp or whatever.
Exactly. There's much better, in terms of health, better options. He did not do any deprivation diet, by the way. Nelson did not say, I'm going to only have 1,200 calories a day. Nothing like that. He just maximized vegetables and fruits first. He maximized grains in his diet. He tried different grains he's never tried before. He had nuts, seeds, he had fish, I think like 3 times a week. And that's where our nurse, who was a former French trained chef, came in handy, because she was really able to work with him and his family on how to prepare those meals.
Did he do any intermittent type of fasting
Oh,
also?
I'm thank you. Yeah, he did do intermittent fasting. Yeah, he ate within a 10-hour window. Exactly. So it wasn't even the 8-hour, but he ate within a 10-hour window every single day and did not eat outside of that.
Thank you.
Yeah.
Hi, Dr.
Yeah.
Shah. This is Sylvia. I wanted to ask about alcohol. How do you recommend your prediabetes and diabetes patients on a healthy alcohol consumption?
Right. Thank you for bringing that up. So that EPIC trial I mentioned, that huge European trial, had done a sub-analysis of 600,000 patients. And what they found is that no amount of alcohol actually helps helps your heart. So alcohol is not good for your heart, despite the way that we've kind of pushed things for many years.
Yeah, no matter what kind of alcohol then.
No matter what kind of alcohol. Now, go ahead. What were you going to say?
No. And you know how about the antioxidants and the red wine, are we trying to justify all of that?
So this is a good question, antioxidants and red wine. So the main thing we're talking about is resveratrol. Well, in the mouse studies of resveratrol, if you were to extrapolate that to humans, you'd have to have about 308 glasses of wine a day to get the amount of resveratrol you need to lower your blood pressure and help your heart. It's just kind of a way to push. And I'll tell you, I like my wine, I like my beer, I love making cocktails. And so I work with patients, I'm not telling you to have to give up everything you enjoy, but don't think that don't think that drinking this is actually helping your health. Just be aware of that and find that balance. Another interesting thing is, the recent recommendations have changed, and we're now kind of going more towards a max of 1 drink a day instead of 2 drinks a day, especially if you're over the age of 65. So regardless of whether you're a man or a woman. But less is better is essentially the recommendation there. Now, you mentioned, regardless of the type of alcohol, one thing we haven't even brought up in this talk, which is really important to prediabetes, diabetes, is our gut microbiome. Raise your hand if you guys are sort of aware of the importance of our microbiome and what that means. Great. So a lot of people are, and our microbiome is our balance of our, healthy bacteria in our gut. And that bacteria actually has grown symbiotically with us for many, many years, and can actually help process sugars and help a lot of the function of the cells in taking up insulin. So when that's disrupted, we're more likely to have diabetes, and we're more likely to have high blood sugars in the setting of diabetes too. Beer, by the way, has a lot of probiotic content, so there is some benefit there too. So,
Hey, Sagar, there's a question from Karen. With the pandemic ongoing, supplements like zinc is hard to find. Can we get it through food? And if so, what kinds of food?
Yeah, you can get it through food. There are a lot of fish that you can get zinc through, a lot of vegetables and fruits. Off the top of my head, I can't remember what specific, but there are quite a bit of foods that actually can help with zinc. So, if you just did a simple Google search, you'll be able to see that. I can also look that up for you and get that information to you. But zinc should be easy to find, to be honest. Have you looked for it? I know in Hawaii, it's a lot harder to find things in general, but zinc is everywhere. So if you have trouble finding zinc, you can also reach out and I can get you information on that too. Again, maybe Amazon's the easiest way to get that too. Any other questions?
Hey Sagar, you started to talk about fascial, some practice that you do. Is it fascial distortion?
Oh yeah, thank you. Yeah, so for me, one of the things that I really try to do is every year learn a new skill, and in integrative medicine. And fascial distortion model is something I've been really practicing for the last 1.5 to 2 years. And what it is a manual manipulation technique that is working on our fascia. Our fascia is our connective tissue. It's the largest organ in our body. It's actually the thing we really ignore in a lot of the medical care that we do from an orthopedic standpoint. So when you get an MRI, you see that your rotator cuff muscles are torn, or you're having an injury in your knee, or whatever it is, you're not really thinking about our fascia. but our fascia is overlying our muscles, our ligaments, our bones, and our tendons. And when you fix that, often you can actually get people's range of motion back. You can reduce pain significantly. And, I can tell you many cases where that's been beneficial. It's been really great practicing on the VA because the number one thing people come in with is musculoskeletal injuries. So that's one example. Again, I'm just trying to mention that integrative medicine has so many cool applications, in our lives that we're just not thinking about in conventional medicine. Another thing I'm training in December is medical hypnosis. So, that's been shown to be really effective for so many conditions. One of the most common things that's used for is smoking cessation, but it can be useful for anger management or, even eating patterns that are unhealthy, for example.
And I did want to mention that Sagar still has his license in Hawaii, and he is working towards accepting patients. Is that correct, Sagar?
Yeah, I'm thinking about how to do that. I'd probably do some combination of virtual care and, eventually, set up sort of periods where I'm in person and able to see people in person for those periods. But, that's my goal eventually. So I'm learning how to use technology just like everyone else. But luckily, as part of my VA job, I've been 50% virtual during half of the pandemic. And so I'm learning, that it's a lot easier than we think it is. But that's my goal. So, in the next couple months to actually launch a practice where I'm still, starting to care for patients in Hawaii.
Yeah, and I'll go ahead and I'm recording this. So we'll go ahead and send the recording and information out to everybody and how to contact Sagar for when that happens, because he's just an amazing, as you can see, and he's so passionate and so caring. So definitely somebody you want on your side for your health.
Thank you. And I just want to thank you guys for, having me here. And, this was such a great opportunity to connect with everyone in Hawaii and to practice this process of talking, to a computer. And so, thank you guys. And I'm here if you have any questions, just reach out if you have any questions that come up even after this presentation.
I have one.